right. So if I've got this technology game right, hopefully you're going to see a chessboard appear somewhere on this screen. And I just wanted to talk through this individual and I guess give sort of a working hypothesis as to how we might sort of manage what we're seeing. So this patient has been seeing us for some neck and back stuff, but in a recent appointment they mentioned that they've been dealing with recurring right ankle sprains throughout their adult life. They had one bad incident in the past. They didn't manage it too well at the time, and subsequently they found that they've rolled it lots and lots and lots. And look, we can sort of talk in regards to where we're at from sort of a tissue health standpoint in the ankle itself and whatnot. Eventually they did try and sort of address it in the conventional way, and found that it's not really made much difference. And really all we can sort of play is the situation at hand. So what I wanted to do, I guess, is just talk through what, when we look at that chessboard, what we're seeing, and I guess just talk through what a working hypothesis is in terms of how we might sort of go about or sequence our treatment, looking at this more from sort of a systemic standpoint, and I guess some of the influences that might be sort of beyond sort of the tissue-based nature of the ankle itself, sort of be a reason why we might sort of see this this continuation or recurrence of these right ankle sprains. And we'll go, I guess, talk through sort of how we might sort of sequence things. Again, sort of talking about it more from a hypothetical standpoint, because I guess whenever we sort of play around with this type of stuff, we've got sort of a thought in mind as to what we do. But the decision-making process is always, we do something and then we assess response to determine whether we're one, on the money, two, what decision we make from there. Is it we continue along the sort of the sequence of thought we had, or do we need to readjust our thought process because it didn't go exactly as we want? To give sort of some insight as to how we interpret that chessboard that's been posted up, the way that we sort of read those numbers to give sort of an idea of how this person's organising their system is this individual is going to be standing heavy on their right side. Effectively they've got 2 feet sort of planted down on the ground with a thorax that is trying to twist really, 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 really fast to the right, but they're still keeping 2 feet effectively grounded. So their left side wants to lift and take a step, but it's not. So what we sort of see is this massive differential between sort of thorax and pelvis, which creates sort of like this big ringing of a tail effect. And so this is exaggerating for effect, but if we sort of really take note of the things that we sort of see here, particularly sort of what's happening from a lower limb standpoint. One, I'm starting to really roll to the outside edge of my foot. I've got a nice sort of high arch foot that is really struggling to get inside pressure, medial pressure through my foot. I've got a leg that feels as if it is bowing, and there's sort of a big sort of twisting force through it. And a lot of that's being driven by sort of this twist that's happening through the thorax itself. So if we focus only on the ankle itself, we might try and do some soft tissue type stuff, work on some single leg balance, whatever sort of we would do with our traditional approach. But reality is there's this systemic influence in the background that's still trying to sort of take me off my right hand side. And so really, I'm not far off a right ankle sprain. They sort of say, obviously there's lots of different causes as to what can result in an ankle sprain, be it, I step in a hole, I land on someone's foot, whatever else it is. But simplistically, an ankle sprain is effectively just a medial foot that didn't get to the ground quick enough. If my system's organising itself in a manner where I'm already struggling to get my medial foot down, then my likelihood or chances of falling into that inversion sprain are only sort of magnified in that circumstance. So in terms of sort of talking about how we might try and sort of reverse engineer this process, we want to sort of address the main influence to begin with, and then subsequently, if we can address that, we'll work our way through some subsequent steps. So again, talking sort of in a perfect world, in this circumstance, a big driver as to what's sort of making the rest of the system play catch up is up top here. So I've got a thorax that's traveling faster than a pelvis. And so what I want to try and do at the moment is slow down the rate of turn of that thorax so that I can get the pelvis to play a bit of catch up. If I can get those two to play a little bit of catch up, I'm now putting myself in a position where I can sort of reposition this limb to start to, I guess, apply a little bit more internal rotation to push myself and sort of come off that foot and project my center of mass towards the other side. But until I sort of address this mismatch here, I've got sort of this propensity for my system to want to turn. So first step, slow this down, get the pelvis to play a little bit of catch up, And then I'm trying to give myself, I guess, some good contact from a foot perspective to be able to sort of plant or apply some internal rotation down into the ground to be able to sort of push myself the other way. So step one, slow down, catch up. From there may well be, in terms of chasing some good bony contact, there might be some bony shape stuff that I need to sort of play around with here. So if we sort of consider that, in this representation, I'm most likely, and in this individual I do have this bow-legged presentation. I want to ensure that I'm playing around with some muscle activity type stuff, some bony shape type stuff, so that I give myself a good lower limb to apply internal rotation through. So I'm probably going to be playing around sort of through the femur region and try and sort of reduce some of the pressure differential in that. And then we're probably playing around with a bit of foot stuff to be able to sort of get a medial foot down into the ground. And then from there, we're sort of sequencing other things from there. But that'll be sort of, I guess, the things that we try and sort of run through now in terms of the sequence. We're going to address or slow down thorax, play around with some femur stuff, look to the foot, and we may leave that there. So, if we were talking about sort of slowing this down, an exercise that we might look to utilize in this circumstance is potentially something like a wall walk based on their measures. So, with a wall walk, make sure that's give us a view. Wall walk, any of these exercises we'll find sort of more in depth breakdowns in some shorter videos if you look through my YouTube channel, but we'll give sort of a quick rundown here. Wall walk, effectively I'm going through a movement where I'm going to use the ground as a way to slow down this thorax while my pelvis plays a little bit of catch up. So without breaking it down too much, I'm going to sort of have myself well positioned on a wall. I'm going to bring left knee up towards nose. I'm going to create a good right reach through my right side, and this is sort of the vital component. If I can get this right reach correct and get some good pressure on the rib cage between my shoulder blade and my spine, that's effectively going to stop or slow down my thorax's ability to turn to the right. And with this exercise, I'm paying particular attention to the lower, so that with a thorax that is being sort of slowed down in terms of how it can turn right, I can actually get the pelvis to play catch up and actually sort of come down at the same sort of time as the thorax does. So when I'm playing around with this wall walk, I get this nice reach, I get this good pressure between my rib cage and my spine on that right hand side. I'm going to bring myself up to get heavy pressure on that upper right rib cage. And what I'm trying to ensure as I go through it from here is I want to make sure that my right PSIS hits the ground before my left does. So I'm going to effectively just stay heavy on my right side as I lower down. So the big part of this exercise is the lowering aspect. So again, I'm up tall, I'm heavy on that right side rib cage, I've got good space between shoulder blade and spine, and I'm making sure that I stay right side heavy, and then that right PSIS hits before the left does. And this again is just that, working on that capacity for the pelvis to play catch up to the thorax. So again, talking perfect world, we do that and we get some measures that indicate that the pelvis has played a little bit of catch up to the thorax. So we've got sort of less of an influence up top that would be pulling me towards my right hand side. In this case, the pelvis is playing catch up. And now we're going to sort of play around with our lower limb strategies to try and sort of create good bony contact to be able to sort of put a foot on the ground and step away the other way. So we're potentially now looking at, if we're going to play sort of that bow-legged shape, we're probably looking at thigh here, and we're going to try and reduce some of the muscle activity in the leg, and potentially throw in an exercise like a low diagonal sit as a way to try and sort of, again, further reduce some of that muscle activity in the femur itself. The position or the exercise itself will produce a bit of a torsional pressure through the femur itself, and equally it will create an ability to bring airflow into the rib cage, and that's going to be one of the big pieces in this, is that will help reduce some of the top-down gradient that we'll see in this type of presentation. And so if I can reduce that top-down pressure, I will also take pressure off the bone, which, if it's already got a pre-existing twist in it and I push down on it, that's going to further bow it. So if I can reduce some of that pressure, I'm going to sort of take off some of the demands that would create that bowing presentation. So I might use something like a foam roller on some of the muscles. We'll just talk through VL for the moment, but there'll potentially be some others that you'd hit. But if we do something like a VL, for example, I'm going to try and reduce some of that influence on the femur itself. So in this case, I'd probably work proximal to distal. Whenever we do this type of stuff, we're going to try and work nice and slow, nice and heavy. So I'm going to find sort of just under my greater trochanter. I'm going to try and traction on it. So I'm going to try and pull myself towards midline so that that muscle works or pulls itself in towards midline. And then from there, I'm just going to slowly work my way about 2/3 of the way down the femur. And so working itself nice and slowly, I'm probably taking 10-15 seconds for a pass. And when I get down there, I'm going to move back to where I started. Again, I'm going to find my pressure, traction, and again slowly work some volume down towards that knee. Again, there's potentially a few different muscle groups we could go after in that circumstance, but I'm trying to, I guess, utilize a tool like that. One, to see what effect that has on measures. So I might do some of my knee measures in this case in regards to my knee bend with external rotation, and also then look at my hip measures to give some insight as to some of the room that I have to play with. I'm most likely trying to do this to get myself in a position where I can land a low diagonal sit. So again, any of these exercises are available in longer format, so just search them up on my YouTube channel. But your low diagonal sit, we're going to sort of find ourselves in a position where we're trying to, again, produce a bit more of a torsional stress on this femur to try and sort of reduce some of the bowing in it. So I want to ensure that I've got a medial knee contact. I've set myself up so that I will produce a very, very soft squeeze through the backside of my glute. So I'm going to very gently push my knee down into the ground. Now, if I exaggerate for effect, if I anchor this inside knee down and I project my hips forward, which is not necessarily, I don't want to do it to this extent, but for purpose of, if I anchor that down and I twist this forward, I'm going to produce a twisting force on this femur that would try and reduce, I guess, the muscle activity that would be contributing to the original bowing presentation. But in terms of doing it, I want to ensure that I'm pushing down only so hard that I could point a finger at where I feel the contraction taking place, and that's going to be in the back side of my hip. And once I'm here, I'm going to push along through my left elbow. I'm going to try and reach this right arm out and head just to create a bit of space between my right shoulder blade and my spine. And I'm going to be just taking some nice long breaths in through my nose and some good breaths out through my mouth as I'm here. And ideally, from where I'm aiming to try and sort of feel any sort of expansion is in this lower aspect of my right rib cage. And that plays into this whole idea of trying to take some pressure off. So if I can get airflow up in here, imagine it a bit like a helium balloon in a sense. I am trying to produce something that is going to lift me away from the ground. And if we're talking about this bowed leg representation, some of that will be contributed just by pressure down on it. So if I can reduce some of the pressure on it, it's going to uncoil a bit like a spring. So we'll say in that circumstance, again talking in ideal world, we've started to reduce some of that effect of the femur, and we're giving ourselves a bit of a better femur shape to be able to sort of land a foot contact. The nature of this individual's foot, when we look at them here, they do have a very, very, very high arch foot. They do have a lot of muscle activity underneath the foot, and ideally what we're trying to get to is a point where we can get 4 points of contact. And so that being inside edge of heel, outside edge of heel, base of big toe, base of little toe. Now, if I've got muscles underneath the plantar aspect of that foot that are really, really busy and aren't very, very good at relaxing, I'm going to have a hard time landing those contacts. Now, it might be with some of the things that we've done with reducing some of those influences that I actually can get myself at a foot contact standpoint. If I can't, I might need to get in there manually to try and reduce some of that. So this could be where we're pulling out some of our tools again. And I'm going to go with something like a little flex bar. And we're going to work some of the muscles underneath the plantar aspect of the foot. We're going to, in this case, work from base of big toe towards our heel. And I want to, as I'm doing this, I want to try and relax my foot as much as I can over the top. So if you're using something like a trigger ball, I just don't have one in here, would have thought I forward planned a little bit better. I want to feel as if my foot is rolling or bending over the top of the foot, more just like it's relaxing over there. I don't want to feel like I'm pulling it down, it's just more like it's folding itself over there. And I'm going to slowly work from base of big toe towards the heel. And then I'm going to come back fast to where I started from. And I'll start to just sort of mow little strips from sort of, first metatarsal to the space between first metatarsal and second metatarsal to second metatarsal. We're just going to be sort of mowing strips along those plantar muscles. Again, working slowly from the base of the big toe towards the heel. Now again, I reduce some of that influence. So what we've sort of worked on doing at the moment, we were here, we tried to slow this down, get this to play catch up. We still had sort of this bowing representation through the femur. We've tried to reduce some of that. We had some foot busyness, some muscle activity, which we're trying to reduce so that I can get 4 points of contact. And where we may leave it here is just what we might try and do from an exercise standpoint to take advantage of producing a sensory input through those 4 points of contact to propagate some internal rotation up the system. And then from there, depending on what the measures are that we get, the world's our oyster in terms of what we do from here. So exercise-wise, we might look at something like a right three-quarter right side line, where by trying to reduce some of that muscle activity and produce some of that ability to get some of those bony contacts, we might find ourselves in a position where we can try and get this good foot contact alongside everything else. So our right three-quarter side line, we're going to set ourselves up in right side line itself. We're going to try and pay attention to some bony contacts here. I want to try and ensure that I've got a lateral knee contact. And we're going to sequence it in this order. We want to get lateral knee contact inside, or my foot contact, particularly sort of inside of heel, base of big toe. I'm then going to try and roll and find the back side of my pelvis. And I want to find my right shoulder blade as well. So I'm going to set myself up. I get my knee contact. I find my foot contact. I'm on my pelvis. I've got my arm rested underneath my head, but I'm going to then sort of use this left foot to turn out and really maximize those contacts on the back side of the pelvis and my shoulder blade. So from here, my knee's anchored down, the inside of the foot's down. I've got my left foot sort of stacked on top of the right to begin with. I'm going to try and turn out from the hip as opposed to the foot. So it's not a turn out of the lower leg per se, it's a turn out of the hip, where from here I'm going to try and turn out maximally. And I'll find that there's a point where I physically can't turn out anymore. I'm going to get a lot of activity through the back side of my left glute as I do this. So when I feel as if I can't turn any further, I get the contacts through my pelvis and my shoulder blade. I'm going to ground my left foot, and then from there I'm going to continue to push or try and turn that knee out, turn that foot out, which at this point is actually, because it's like running into a wall, it's going to turn me down into my right side. So I'm going to feel as if I get heavier on those right side contacts. I'm going to ensure that I maintain that medial foot as I'm here. And then what I'm going to do is just take some breaths as I lie in this position. So I'm going to take nice, long, slow breaths in through my nose. And nice, long breaths out through my mouth. Continuing to hold that pressure on my left side, so that I get heavier on my right side and I'm starting to propagate some internal rotation up my system. And that, from a sequential standpoint, looks to take us from our starting representation into a position where I'm actually able to start to apply some internal rotation through that right side. So again, starting representation was here. Try to slow down the thorax, get the pelvis to catch up, try and reduce some of the muscle influence on that bow leg representation, do a low diagonal sit, get some air up in the system and reduce some of this muscle activity, get a foot, and actually try and sort of put ourselves in a position where we can actually apply some pressure through that foot where internal rotation can propagate up the system. And ideally what we'd sort of see in this case is we'd start to see some of our right early measures increase external rotation and internal rotation, which is going to put us in a position where we can start to take some center of mass and some center of gravity from the right side and actually start to push it left. And in that circumstance, now I've not got this system that's trying to turn me right with a foot that's struggling to get the medial foot down. I'm now in a space or a position where I can start to push off it and go the other way, and that's just going to reduce, this circumstance where I'm living on the right side of my foot, and I'm not far off that recurrent ankle sprain.